Good morning, everyone, or good afternoon, or good evening, wherever you are. My name is Shirin Heidari. I'm the founding president of GENDRO, an association that has for mission to promote and foster gender-sensitive research and analysis. I'm also the founding chair of the Gender Policy Committee of the European Association of Science Editors. And we are very pleased to be here with you today, even if only virtually, to share with you our efforts to advance and foster better gender-sensitive research. We've known for long that sex and gender play an important role in research. In health research, a complex interaction of sex and gender alongside other critical variables can influence exposure to risks, susceptibility and vulnerability to diseases, how we experience illness, how we respond to treatment, how we interact with healthcare workers, and our experiences of health systems, among other aspects. But we have and continue to neglect these important variables in research. We have created a research system and culture that is persistently gender blind at best and often gender biased. The gender bias is a result of the historic androcentrism in medical research, where females have been excluded from health and medical science to a great extent, which in some cases have resulted in negative outcomes for them. And this gender blindness can also disadvantage men and non-binary people. Our failure to examine sex differences or the complex gender dimensions leads to a lack of understanding of the differential experiences of health and illness, needs and access issues of women, men, and gender diverse people. In the past decade, there has been an amplification of initiatives to address the gender insensitivities in research. These efforts, in their variety of forms and shapes, strive to transform the way in which we produce and use research and aim to create long-lasting and sustainable changes towards better research practices. But as we know, research is not an isolated event done by a single or a group of researchers in a vacuum. Research of any kind is conducted within a larger scientific ecosystem that sets and reinforces standards for quality, ethics, rigor, relevance, among other key aspects. And across this research ecosystem, there are different checkpoints served by different gatekeepers to safeguard research integrity. These checkpoints are excellent entry points to introduce some structural changes. And today I would like to tell you the story about how we focus on one of these gatekeepers, the scientific journals and editors, and we took the opportunity to promote and foster a systemic incorporation of gender dimensions and gender analysis in research. Editors have been and continue to be a driving force in developing international standards and frameworks to ensure more transparent and complete reporting of scientific findings. We have a number of reporting guidelines developed by editors that have been adopted by prestigious journals and are being followed by authors. In 2007, when I joined the International AIDS Society as the editor of the Journal of the International AIDS Society, I noted a concerning absence of reporting of gender dimensions in manuscripts that were submitted to my journal. As the editor, I leveraged my position and introduced a gender policy in my journal in 2010, encouraging authors to report data disaggregated by sex and provide a gender analysis to the extent it was possible. I also facilitated similar steps in other HIV journals, and these steps resulted in a larger discussion on the role of editors in addressing the issues, to begin with in the HIV field. But let me remind you, or perhaps highlight, that the concerns of gender blind reporting is not limited to the HIV field, and it's actually very common across disciplines. Sex or gender of subjects are not reported, or if they're reported, data are not disaggregated by sex, analysis ignores any potential sex and gender differences and often disregards broader gender dimensions, and findings are presented as if of general applicability. In late 2011, the very first Gender Summit in Brussels played an important role because it catalyzed what I often call the start of a public discussion on the gender bias in reporting and the role of editors to address that. The panel discussion that was hosted by the Gender Summit inspired the gradual recognition about the persistent gender blind reporting in scientific journals and shared concerns that it can reduce reproducibility, which is a cornerstone of science, compromise rigor, and even cause harm. The following year, in 2012, the European Association of Science Editors showed bold leadership and established the Gender Policy Committee, through which, and following a consultative and elaborate process, we developed the Sex and Gender Equity in Research Guidelines, the SAGER guidelines. The SAGER guidelines serve several purposes. It helps to raise awareness about gender blind reporting and research. It provides a rationale for why gender sensitive research and reporting is important. And it offers concrete tools to support researchers, authors, editors, peer reviewers to address the problem. The SAGER guidelines include tools for researchers on how to consider sex and gender in the research design and conduct, and offer clear guidance to authors on how to report their findings. We also provide recommendations and propose a series of concrete changes editors can introduce in their editorial procedures and practices to promote more complete reporting of these dimensions as a matter of routine. I'm not going into the details of the recommendations and the tools provided in the SAGER guidelines, but I warmly encourage you all to read it, and we also very much welcome your feedback. So the question is, has it been successful? My answer would be a partial yes. The SAGER guidelines are now widely known, widely distributed and cited. It has been downloaded more than 25,000 times. We have more than 100 individuals from a variety of journals, publishing houses, and academic institutions who have endorsed the guidelines. The guidelines are listed in the Equator Network's list of reporting guidelines and promoted by various initiatives such as Gendered Innovations. We are also a regular speaker at the Gender Summits. We have even a TEDx talk that covers the rationale and the history of how the SAGER guidelines were developed. And there is an increasing number of journals and publishers who are endorsing it and, most importantly, adopting it. For example, a growing number of journals have introduced it in their instructions to authors, the guide for peer reviewers, and writing editorials to raise awareness about the importance of the issue, but also the new policy in their journals. Some journals have also taken it a step further to systematize it and include it in their submission systems. Of importance is that the guidelines have also been translated into several other languages. And we are also having other language translations that are on the way. And this has happened through fruitful partnership with various editorial societies and academic institutions. And this is particularly important to us as it helps expand the reach beyond English language journals and hopefully amplify its impact. But of course, we are by no means done. We still have a long way to go before we have transformed our scientific reporting practices. We are at a juncture where we need to accelerate the adoption of the SAGER guidelines, ensuring that the principles of incorporating gender dimensions in research and reporting gender data are an integral part of our thinking and academic practices. This requires, of course, close collaboration with a number of stakeholders, including publishers, who are now taking significant steps to review and improve their procedures and practices. It requires time and resources to ensure continuous awareness raising, capacity building, monitoring and evaluation, and it requires the support of every single one of you. It really needs a movement. So if you allow me, I will take a few minutes to suggest some simple steps that you all can take to contribute to the wider dissemination and adoption of the SAGER guidelines and the principles it offers. First, we would appreciate your endorsement. As an individual or another organization, you can endorse the SAGER guideline on EASE website. We will also welcome if as an organization you can highlight your endorsements on your website by making a statement, as has been done by COPE, for instance. You can also write editorials, commentaries, letter to the editor, and raise awareness about the significance of sex and gender in your specific areas. You can give lectures, workshops, webinars, seminars about the SAGER guidelines or about the principles of incorporating sex and gender dimensions in research and in reporting. And we are happy to support you in organizing webinars or other opportunities to the extent we are able to. So do feel free to get in touch. If you are an editor or an editorial board member or have any other affiliation with a scientific journal, you can promote the inclusion of the SAGER guidelines in the instructions to authors, the guide for peer reviewers, and also supporting capacity building about the editorial teams and the editorial staff. And finally, we all serve as peer reviewers at different times in our professional and academic careers. If you are a peer reviewer, use the principles in the SAGER guidelines to assess the manuscripts that you are reviewing. And in your suggestions to authors, encourage the authors to read and follow the recommendations in the SAGER guidelines to improve a more complete reporting of the gender dimensions and aspects in their manuscripts. Of course, it's not sufficient to only address the reporting aspects. We need to work closely with other stakeholders and align our efforts with other key gatekeepers in the scientific ecosystem, such as funding agencies, ethics committees, regulatory bodies, and normative agencies. The SAGER principles can be adopted and implemented across all of these other gatekeepers. Through both EASE and GENDRO, we work closely with some of the key research funding agencies to ensure that the principles of SAGER can be introduced in research grant processes. Through GENDRO, we have also initiated a project focusing on how we can incorporate the SAGER principles in research ethics guidelines and how SAGER guidelines can be adopted to be used by research ethics committees and institutional review boards. We also work with researchers and UN agencies and continuously advocate for a gender-responsive approach, both in research but also in practice. It is time to make incorporating sex and gender in research a matter of routine. It's more urgent now than ever. The emergence and the global spread of the new corona SARS virus have reinvigorated the conversation on the importance of a gender-sensitive response and a gender-sensitive research to public health. We know that infection and risk of death are influenced by sex and gender and vary across age groups. Geographical locations can also change over time. The social and economic implications of the pandemic and the measures taken to contain it are also highly gendered and have already shown to create differential impact on women, men, and gender diverse people in different parts of the world. However, while data and research on COVID-19 are being produced at unprecedented speed, data disaggregated by sex and age continue to be poorly available, and data that go beyond sex to also look at the broader spectrum of gender-related differences are even harder to find. The clinical trials of new medicines and vaccine candidates that have been initiated at an unparalleled rate fail to share information about how they are designed to capture sex differences or how they take into account the various gender dimensions. I want to end by mentioning that at GENDRO, we have issued a call for urgent action to improve systemic reporting of gender data to tailor more effective and equitable pandemic responses. I'm inviting you to endorse this call for action and join us in advocating for a renewed commitment to gender-sensitive research and reporting and a public health response. You can read and endorse the statement on our website. With that, I thank you for your attention and looking forward to building a stronger movement together. Thank you.